Said the director Kusaal okay say OTD neglected now. Ya to sa yareway ejeje and che bi na covid eyiniti o kuro for my Ghana obi adi mirika.
Neglected tropical diseases, NTDs, are a group of 20 viral, parasitic and bacterial diseases, primarily afflicting over 1 billion individuals among the world's most marginalized populations. According to health authorities, Ghana is grappling with 14 NTDs, with each district across the country documenting the presence of at least 2 of the diseases. Advertay is a chief biomedical scientist at the Neglected Tropical Diseases Program.
About my Ghana, you do 914.
Ghana has 14 neglected tropical diseases, and every district in the country has at least 2 of the diseases.
District bay and if you buy as some as the coffee say, opening no fin crime buy and say district high one mania pramenia.
In 2023 alone, the Sekyere East district has reported 2,471 instances of scabies, 22 cases of lymphatic filariasis, 55 cases of yonks, and 5 cases of leprosy. Sadly, there have been 7 deaths among children due to rabies cases. Now let's hear from the District Director of Health Services, Dr. Justice Ofori Amwa.
Sekyere East has so far recorded about 2,471 cases of scabies for the year 2023. We have recorded 7 deaths associated with rabies. We have also recorded 55 cases of yaws. We have also put 5 cases of leprosy on treatment, and the cases are reporting. Again, we have about 22 cases of lymphatic filariasis. All what we are preaching and saying to the general public is the early reporting of any suspected case to the nearest health facility for case management.
What might explain the higher number of cases in comparison to the previous year? Dr. Justice says,
since the last 3 years, the figures keep increasing. All is because the World Vision supported us in case search. The Women's Hope Foundation also supported us in case search. And the more we search, the more we get. It means that the cases are in the communities. So the best we can do is to go out there, talk to people, for all to report any case that they see that looks abnormal to them. Then we will now classify that this is leprosy, this is scabies, this is lymphatic filariasis. And with this, again, we are able to eliminate a disease from the district.
The incidence of these diseases has had a detrimental impact on the economic and social well-being of residents, particularly affecting school-going children and farmers. Dr. Nana Ayu Afriye, the Member of Parliament for Efiduase Asakore constituency, who launched the campaign, has affirmed that his office will persist in aiding the district health services to oversee and address the situation.
It's preventable. It can be treated early stage, looking for the case, official case, capacity building, training.
The diseases are preventable and can be treated. Capacity building for health personnel is crucial, so I have looked for the money for all this.
Around the I looked for the money, and I looked for the money, and I have looked for it.
So we can start our campaign with what we have now. Chiefs, opinion leaders, politicians, teachers, and residents are urged to collaborate with the Health Directorate in identifying, treating, and monitoring cases of neglected tropical diseases. This call to action was emphasized by Dr. Justice Thomas, the Municipal Director of Health Services for Achumanwa-Abinja District and the National Chairman for the District Directors Group.
That there are 3 things to be done if we want to get anywhere on this particular matter, and that is to search, to treat, and to track. If you don't look, you can't find. And if you want to find something of interest, you must look out for it.
The World Health Organization advocates 5 fundamental strategic interventions to expedite the prevention, control, elimination, and eradication of neglected tropical diseases. These include innovative and intensified disease management, preventive chemotherapy, vector control, veterinary public health, provision of safe water, sanitation, and hygiene. A report by Mohamed Nurudeen.